Hello, my dear doctor. I'd like to talk on the respiratory system, Station 1 respiratory system Marksheet, my dear. Because knowing the marksheets and the details, how the examiner is marking on you, we need to know them. If you know them very well, so that you can focus and you can practice on that particular area so that you can improve yourself, my dear. So that's why you need to know at least the marksheets, how the things are really marked on you, my dear. So yes, here is the similarly Station 1 abdomen, as I said, the candidate name and the examiner number and the center number, you need to write them together, and other things will be written by your examiners, my dear. So similarly, the Station 1 abdomen, the Station 1 respiratory system, the 5 skills are assessed, like the A for examination, B for binds, D for diagnosis, E for e-judgment, and G for jail fair. Yes, once again, my dear, the 5 skills are assessed. So similarly, you'll get the satisfactory marks in the examination part. Once again, the casting professional, casting with the correct, appropriate, thorough, and yes, S for systematic, T for thorough and fluent. And once again, the professionalism. It is written here, the correct, thorough, fluent, and systematic, and professional techniques or the palpation, percussion, auscultation of the chest, my dear. As I said, the CEP and BSVR means the chest expansion, percussion load, breath sound, and vocal resonances that are really marked on, that the examiners are really looking at you, whether you are examining that particular part or not. You'll get the unsatisfactory marks that if the techniques are incorrect, omits the significant or important test, and unsystematic, hesitant, lacking in confidence, and unprofessional. The identifying the physical signs, that identifies the correct physical signs, my dear. Like that you found the CP and BSBR, everything is reduced down on the basal part, and also you found the fine and inspiratory crackles. So yes, you get the satisfactory marks. Does not find the signs are not present. If the crackles are not there, you say that you found the crackles. So yes, it is dangerous, mind. It is written here. So the misses the important physical signs and finds the signs that are not present. If the crackles are not there, you say there is a crackle. So yes, you'll get the unsatisfactory marks, mind. Differential diagnosis constructs the sensible differential diagnosis, including the correct diagnosis. Whatever the diagnosis, you say the differential diagnosis, the correct diagnosis should be in your list, my dear. If you say the 3, 4, 5, at least the 5th or 3rd number of the diagnosis, it should be the correct diagnosis. So they will give the satisfactory marks. In contrast, the unsatisfactory means that the poor differential diagnosis, yes, and fails to consider the correct diagnosis. Clinical judgment means the sensible and appropriate management plan. It includes the investigations and the treatments, what you treat now and later on, what the planning, my dear. Similarly, you'll get the opposite side, the unsatisfactory, that is the unfamiliar with the correct management plan and selects inappropriate management. And maintaining the patient welfare, once again, treats the patient respectfully and sensitively and ensures comfort, safety, and dignity. In contrast, you'll get the unsatisfactory marks like the patient safety, if you're not right, maintaining that one, that cause the patient physical or emotional discomfort, jeopardize the patient's safety. Usually the gel fair starts from the gel might at the end wash, and also keep the patient in a comfortable state. Don't make the patient uncomfortable. Don't make the patient sitting, standing, lying many times. So it will be really a discomfort for the patients, because the patients are really patient. They are really suffering some of the diseases. So if you're making them, and another candidate is coming, another candidate, so 3, 4, 5 candidates are examining the single patient. So yes, really a discomfort for them. So please be careful about it and just follow me, my dear. The way that I'm examining from A to Z, that will provide you, my dear, the gel fair marks, definitely the satisfactory marks, my dear. I hope that, my dear, knowing these facts, the 5 skills, how these are assessed by the examiners, you'll get the full satisfactory marks, my dear. Immediately after that, I'd like to share here the important things. There is the examiner calibration sheet, my dear. Examiner calibration sheet, it does mean in respiratory station. You see, this is the examiner calibration sheet. And in that sheet, it does mean this sheet you will not be provided. You cannot see that. It is only for the examiners. So examiners, their physical signs agreed to be present. The 2 examiners, before starting the exam, they agreed together. They thought about, yes, this gentleman has got the clubbing and found some of the crackles, finding inspiratory crackles. And these are the 2 important, or maybe 3, 5, 4, 5 findings. So they're written down there. And also the signs and the differential diagnosis and the clinical judgment, they write down by themselves, agreed together, so that on this standard basis, they will mark on you, my dear. So this is called the calibration sheet. Knowing these facts, it will helpful, my dear, how to focus and how to focus your preparations, my dear, on which areas, so it will be really helpful. So knowing the facts of the mark sheet and knowing the facts of the calibration sheet by the examiners, it will be tremendously helpful, my dear. I hope that, my dear, you got my point. Thank you very much. Thank you once again.